morning. My name is Sandra Schroeder, and I'm the nurse practitioner student at St. Anthony College. I will be performing your abdomen exam today. What is your name?
Leah.
Hi, Leah. How are you? How old are you?
10.
Are you 10? Okay. Do you have any pain? No, in your belly? No. Okay. I'm going to wash my hands first. Okay. Okay, Leah, at first I would note your general appearance. You appear well dressed, well groomed, alert oriented. I will check your vital signs, and I'm going to ask you to lay down. Just lay down comfortably, put your hands on the side, and I'm going to expose your sweatshirt, okay? Just don't want to see the belly. So first I'm going to inspect your belly, your symmetry of the belly. It's equal. I'm going to look at the contour, if it's flat, protuberant, or scaphoid. It's flat. I'm going to note for any abnormal peristalsis. There's none. I'm going to look for any abnormal pulse, aortic pulsation, and I don't see anything. I'm going to look from both sides. I'm going to observe skin for any stria, for any lesions, for rash or masses. And the other part will be auscultation, okay? So I'm going to listen with my stethoscope to your belly. I'm going to listen in 4 quadrants, and I'm going to note the vowel sounds. So don't get scared because it's very cold, the stethoscope, okay? I'm going to start with right lower quadrant. I'm going to observe for character and frequency of the vowel sound, how frequent they are. Yeah. I can hear them. They're, I would say, normal vowel sounds. They're not frequent and they soft. Going to do the upper part and the last quadrant. Okay, so the frequency is noted at the right lower quadrant. They're the loudest one at this point. So now I'm going to listen to the aorta with the bell of the stethoscope. I'm going to identify if I can hear any bruise, any turbulent blood flow. No, I'm going to listen for renal artery, and then the left. Then I'm going to listen for iliac, right artery, and then the left one. Okay, and now I'm going to listen for your liver, for any venous humps or friction wraps. Okay, I don't hear any friction wraps or humps. The same I'm going to do for the spleen. Going to listen for any venous humps or friction wraps. Okay, so the next step will be percussion. So I can put this away for now. And I will just percuss in 4 quadrants of your belly, okay? So it shouldn't be very painful, but if you feel any discomfort, let me know, okay? So I'm just going to start with the upper one here. Okay. So the sounds seems normal. I'm going to percuss your liver and we'll see for the dullness, okay, of the liver. So I'm going to start here. Okay, and now I'm going to do the same. I'm going to start with your umbilicus and I will move forward. Just going to measure. So this measurement will give us the span of the liver. So it's going to be around 2.5 centimeters. I'm going to also listen, let's percuss for splenomegaly. So I can ask you to take a deep breath. Going to the lowest rib here at the mid-clavicular. Okay, good. And now I'm going to start with the palpation. I'm going to ask you to bend your knees. Just bend it. So I'm going to just palpate the same way I was kind of percussing in the 9 quadrants. And you tell me if you feel any pain or tenderness, okay? There is no guarding, no tenderness, and no masses found. Now I'm going to do deeper palpation, so that may be a little bit more painful or maybe not very comfortable. But let me know. So if we would find any masses, we will want to note their location and tenderness, consistency, and pulsation, and also mobility. But I also can check with the palpation maneuver. I can check for rebound tenderness. So that way we will identify any inflammation. So any tenderness here? No. So we can kind of press it very deeply and see if patient has any pain. So I'm going to palpate now for the liver enlargement or tenderness. So I'm going to put my left hand posterior to the patient here, and I'm going to kind of put my right hand on the umbilicus and try to palpate gently. And when I'm ready to feel for liver border, I'm going to ask the patient to take a deep breath, okay? Can you take a deep breath? Okay. One more time. Okay. You're skinny, so it's easy to feel it. So the same I could do kind of on the opposite side. I would feel palpate for the spleen tenderness. Okay, take a deep breath. Okay, any pain? No tenderness. Okay. We can kind of feel for the kidney tenderness too if we palpate this way, but do you have any problems with palpation, any pain? We can also check for aortic width with the palpation, so we can kind of relax your muscle a little bit. She's very skinny and she has a lot of muscles, abdominal muscles, so it's really hard to palpate that aortic width. but we would want to trap aorta on each side, and kind of try to approximate the distance between two edges. So also we can check for costovertebral tenderness. We can also ask patient to sit up for me, and I can posteriorly see if she has any tenderness. Any tenderness? No? Okay, so this is one of the special tests. We'll use our fists. We can palpate kidneys this way. We can also check for ascites. So for ascites, if patient has a lot of ascites, you can lay down for me. We would percuss outward until we note the change of the sound. In normal person, there is tympani in dullness, and they are constant. In patients with the ascites, there will be change of the sounds. But we wanted to percuss outward from the tympani to dullness. And then for appendicitis, we would do like 3 signs. One of that is Rosvik sign, and it's the sign in the right side pain when patient is palpated or applied, when the pressure is applied on the left side. So I will ask you, Leah, if you have any pain. Do you have any pain on this side? No. Okay, so that's the one of the sign. The other sign is the psoas sign, and that's the right hip flexion and pain during resistance. So for example, flex that leg for me and try to oppose my hand. Do you have any pain in your abdomen? No. So positive psoas will be like positive for pain. And the other one is the obturator sign, and we can ask patient to flex the hip one more time. We can do internal rotation as patient. We can ask patient to cough at the same time. Can you cough? Do you have any pain here? No. Okay. And then another special test is cholecystitis, and that's the Murphy, positive Murphy test, and that's done on the right side. We would palpate liver edge, and we'll ask patient to take a deep breath. If patient has any pain, especially during when sharp pain occurs during the inspiration, that's going to be positive Murphy sign. So in order to do that, I have to stand on the other side so I can be on the right side of the patient, and I will just palpate the liver edge. So we'll do the same technique as before. So take a deep breath. Any pain? No. Okay. So I think that concludes our exam. Thank you, Leah, for participating in the abdominal exam. We are all done today. Thank you so much.